Pharmacology, the cardiovascular system. Antiarrhythmic drugs, Class 3, potassium channel blockers. Class 3 medications prolong repolarization by blocking the potassium channels in cardiac cells that are responsible for repolarization. They are used for emergency treatment of ventricular dysarrhythmias. Amiodarone is an example of an antidysarrhythmic that has predominantly Class 3 properties. Class 3 medications prolong repolarization by blocking the potassium channels in cardiac cells that are responsible for repolarization. Amiodarone also antagonizes alpha and beta receptors. Amiodarone is indicated only for the treatment of life-threatening recurrent ventricular arrhythmias when these have not responded to documented adequate doses of other available antiarrhythmics, or when alternative agents could not be used. Amiodarone can cause fetal injury when administered to a pregnant patient. Use cautiously with the geriatric population who may have decreased hepatic, cardiac, or renal function. Read drug label information carefully due to several potential drug interactions. Amiodarone has several fatal toxicities such as pulmonary toxicity, exacerbation of antiarrhythmia, liver injury, and heart block. Patients who require initiation of this therapy should be hospitalized and monitored closely. Neurological impairments such as fatigue, tremors, involuntary movements, poor coordination and gait, and GI disturbances are common adverse effects. Vision changes, loss of vision, and photosensitivity may also occur. Patients should be advised to closely follow the recommended dosing regimen. If one dose of medication is missed, the patient should follow the normal dosing schedule and resume with the next dose. If more than one dose of medication is missed, the patient should call the healthcare provider for guidance. Patients should be compliant with all follow-up appointments and monitoring. Patients should avoid drinking grapefruit juice during medication therapy. Some patients may experience photosensitivity and protective measures should be taken. Class 4 antiarrhythmics, calcium channel blockers. Class 4 medications include the calcium channel blockers verapamil and diltiazem. These medications increase the refractory period of the AV node by slowing the influx of calcium ions, thus decreasing the ventricular response and decreasing the heart rate. This medication may be used to control heart rate associated with supraventricular tachycardias. Calcium channel blockers are also used to treat hypertension because they relax smooth muscle and cause vasodilation. See the antihypertensives section for more information about their use in treating hypertension. The mechanism of action. Diltiazem inhibits calcium during depolarization to decrease the workload of the heart and increase oxygen supply to the myocardium. This medication will relax smooth muscle and decrease peripheral resistance. Diltiazem is used to treat angina, hypertension, and supraventricular tachycardias. This medication is not given to hypotensive patients, patients with acute myocardial infarction, or patients with second or third degree heart block or sick sinus syndrome. Adverse effects. Diltiazem can potentially worsen signs and symptoms of heart failure due to the negative inotropic effect. Patients may experience bradycardia, worsening first-degree AV block, syncope, edema, hypotension, headache, dizziness, or hepatic injury. Patients should be advised to closely follow the recommended dosing regimen. Patients or family members may need instruction on how to take a pulse rate and report any pulse less than 50 beats per minute. Patients should be advised that this medication may cause dizziness and visual changes. Patients may also notice orthostatic blood pressures decrease with position changes and should be advised to change positions slowly. Patients should be advised to avoid grapefruit juice during medication therapy. They should also monitor for gingival sensitivity and be sure to maintain good oral hygiene. Patients may also notice increased photosensitivity and should take protective measures. Antiarrhythmic Class 4, adenosine. Adenosine is a unique medication given to patients who are experiencing paroxysmal supraventricular tachycardia. It is given all at once as a bolus in either a 6 or 12 milligram dose to slow electrical conduction to restore a normal sinus rhythm. The mechanism of action: adenosine will slow conduction through the AV node to restore normal sinus rhythm. Indications for use: adenosine is used to treat paroxysmal supraventricular tachycardia. This medication is an emergent type of medication. Use cautiously with geriatric patients with decreased cardiac function. This medication is contraindicated with patients who have second or third degree AV block, sinus node disease, or any known hypersensitivity. At time of administration, a nurse may also, or medic may also see electrical activity on an ECG for a few brief seconds before normal sinus rhythm is restored. It is important to warn the patient about an extremely uncomfortable feeling during this short period of time. Adverse or side effects: patients receiving adenosine may experience prolonged asystole, arrhythmias, palpitations, facial flushing, hypotension, bronchospasm, shortness of breath, dizziness, seizures, loss of consciousness, numbness and tingling to upper extremities, and nausea. Patient teaching and education: patients should be advised to closely follow the recommended dosing regimen. Patients or family members may need instructions on how to take a pulse rate and should report any abnormalities. Patients should also be advised that this medication may cause dizziness and visual changes. Patients may also notice orthostatic blood pressure decrease with position changes and should be advised to change positions slowly. Patients should be advised to avoid grapefruit juice during medication therapy. They should also monitor for gum sensitivity and be sure to maintain good oral hygiene. Patients may also notice increased photosensitivity and should take protective measures.